This is Hamza Hussain, and a very warm welcome to all of you in Pakistan Cardiac Super League Season 2, presented by Pakistan Cardiac Society and powered by Wilson's Pharmaceuticals. Today, we are excited to bring you the live action of a ninth match, which is between DOW Dolphins and M.I.C Panthers. Before diving into the excitement of the match, allow me to introduce the expert faculty members who have graced us with their presence today. We have with us Professor Khawar Abbas Kazmi Saab. Professor Khawar Abbas Kazmi will be the umpire of this match, and he is currently working as a professor of preventive cardiology at M.I.C Karachi. Along with him, Professor Mohammed Saab will also be the umpire of this match. Professor Saad Saab is working as a professor of cardiology at Karachi Institute of Heart Disease, Karachi. And among the panelists, we have with us Professor Hafizullah Saab. Professor Hafizullah Saab is, without a shadow of a doubt, he is a father of modern day cardiology and a very revered figure of all aspiring cardiologists and a pride of Pakistan. He is currently serving as a chairman board of governors at Peshawar Institute of Cardiology, and we are very thankful for him for being part of this season 2. We have also with the General Secretary of Pakistan Cardiac Society, Professor Fawad Farooq Saab. Fawad Farooq Saab is serving as a professor of cardiology at NSABD Karachi, and we have also with us Professor Abdul Hamid Siddiqui Saab. He is former professor of cardiology at Armed Forces Institute of Cardiology at Rawalpindi. And among the guest panelists, we have with us Associate Professor Dr. Fahim Khan Saab. He is working as Associate Professor of Cardiology at KTH Peshawar. And last but not the least, I will hand over the mic to the moderator of this program, Dr. Hamza Wali, and he will be serving as an Assistant Professor of Cardiology at Rawalpindi Institute of Cardiology. And over to Dr. Hamza Wali Saab to start the formal proceeding of this.
Thank you very much, Hamza. I think we are back again to the most awaited day of the week. And as we all know, it is the second season of Pakistan Cardiac Super League, which is powered by Pakistan Cardiac Society in collaboration with Wilson's Pharmaceutical. So today, we've got another match, another league game, which is going to be very important. In the last few weeks, we've had very close games, and I hope that the legacy is going to continue. And today's match is going to be between DOW Dolphins and M.I.C Multan Institute of Cardiology Panthers. So with this, I would also like to request the dignitaries, our council members of the day, and we have Professor Muhammad Hafizullah. Welcome, sir. We also have Professor Abdul Hamid Siddiqui. We have Professor Fawad Farooq, as instrumental as always, and we do have Dr. Muhammad Fahim Khan, who's with us. And as we move on, I believe we'll have an extended panel experts as well. And we also have Professor Feroz Maimun. He's also with us. So welcome, sir. And definitely, we cannot forget the role of our umpires. The two umpires for the game today are Professor Muhammad Ishaq Saab. Great to have you, sir. And we also have Professor Khawar Kazmi Saab. He's going to be the second umpire for the game. So with this, I'm now going to move towards the two teams and their captains, and I would request them to give the introductions and introduce their teams. So I now move first towards DOW Dolphins for the introduction.
Assalamu alaikum. My name is Dr. Iram. To my left are Dr. Adeeb and Dr. Muniba, and to my right is Dr. Hafsa.
So welcome to the game and best of luck for the match today. Okay.
Thank you, sir.
Right, so we now move to M.I.C Panthers. Captain, introductions please.
Assalamu alaikum. I'm Dr. Sadia, fourth year resident cardiology, and with me is Dr. Arsalan Ibrahim, is final year cardiology resident, and we also have Dr. Farooq Riaz, he's just here. He's also final year cardiology.
Yes, our captain just reached.
Dr. Farooq Riaz.
Right, please carry on with the introduction. I will request all the members to please keep your mics on mute as we are having the introductions, please. Thank you. Yes, M.I.C, you can continue with the introduction.
So I'm Dr. Sadia, fourth year cardiology resident, and I have with me Dr. Arsalan and Dr. Farooq, our team captain, and both of them are final year cardiology residents. Thank you.
Well, again, I would say best of luck to you, and I hope we are going to have a good team and a good match from both the teams together. All right. So I was also, I could see Dr. Ali Raza, who has also joined us in our panel of experts. So welcome, sir, to this show for the first time. I hope you'll enjoy it. And now that we have had the introductions, we are now going to move towards our coin toss. It's going to be an electronic coin toss, and I'm going to randomly ask one of the teams. So M.I.C. Panthers, is it heads or tails?
Heads.
Okay. So they have asked heads. Roll the coin. And it's tails. All right. So we have DOW winning the toss. Okay. So I'm just going to pose two questions to the winning team, which is DOW Dolphins. The first question is, do you want to take the questions or you want to throw the questions? And the second question would be
we
regarding...
want to take the questions, please, sir.
Okay, so you want to take the questions. And I'm going to pose you with the second question, which is going to be a choice between two sets of vignette, two cases, A versus B. Which one?
So case A.
All right, so they have decided to take the questions and from case A. So that's the news from the center. Well, once we are ready, we are now going to move to the first case, case A, and you have the scenario, and I'm going to request M.I.C. to read the question, please.
A 62-year-old lady, known case of diverticulosis with history of permanent pacemaker implantation 5 months back, presented with complaints of high-grade fever and dyspnea NYHA4 of 5 days duration. On examination, patient is toxic looking with heart rate of 110 beats per minute, blood pressure of 100 by 70 millimeters of mercury, saturation of 90% at room air. Cardiac auscultation revealed a pansystolic murmur at the left lower sternal edge, and chest auscultation revealed bilateral crepitations up till mid-zones.
Okay, so I'm going to give you a couple of seconds, DOW Dolphins. Just let us know when you're ready. All right, so let's
so we are
just...
ready.
Good. Let's just move to question number 1. M.I.C., read the question, please.
Which of the following are class 1 investigations in evaluation of this patient? A. Alpha blood cultures, B. Bravo echocardiography, C. Charlie WBC SPECT, D. Delta both A and B, and E. A, B, and C.
And your 60 seconds start now.
WBC major criteria में blood pressure echocardiography तो करके आ जाते हैं तो फिर D option होगा
Only the answering teams to keep their mics open. Rest, I would request to keep their mics shut.
We are going to go with an option B, Delta. Sir, option D, Delta, both A and B.
All right, so 20 seconds to go. You are sure about Delta?
Yes, sir.
Okay, so that means they are sure. They think it's going to be a 6. Lock option D, Delta. Oh, yes, these are overcast conditions here, and you may have more swing than expected. So, never mind. Be careful as you have question number 2 on your screen.
Patient undergoes an echocardiogram. The patient undergoes an echocardiogram that reveals severe tricuspid regurgitation and vegetation measuring 9 by 8 mm attached to the pacing leads. 2 cultures taken 12 hours apart show no growth. Based on the data provided, what is the patient's Duke criteria? A, alpha definite, Bravo possible, C probable, D rejected, E none of the above.
60 seconds on your screen.
vegetation का size major criteria
One major, one
major for हमारे पास fever efficient fever में evolution science आ रही है जो एक major हो गया और दो minor हो गए हमारे पास
fever is minor हो गया दूसरा tachycardia
Come on, Dolphins, you can do it. Approaching 20 seconds. 15 seconds. 10 seconds. Come on. Answer. 6, 5. Come on.
Sir, A definitive.
Okay, so
Sir, A definitive.
A definitive. Lock it. Oh, goodness. Definitely. It's turning out to be a bit tricky for you. Never mind. So another.
Not a bad start, Hamza.
Very sure, sir. Very right. It's a bad start, but they quickly have to capitalize on the rest of the questions now. 8 to go. Next question, question number 3. Read, please.
Qualifies as possible CIED infective endocarditis. What is the class of recommendation of thoracic CT to detect septic pulmonary embolism as per 2023 ESC guidelines? A class 1, B class 2A, C class 2B, D class 3, E no recommendation for thoracic CT.
And the timer starts now.
Zero.
अच्छा माइक बंद कर दे वहीं से बंद कर यहाँ से बंद कर
So I would request M.I.C. Multan to mute, but when you start reading the question, don't forget to unmute. Thank you. Come on, Dolphins, 25 seconds. 20 seconds. 10 seconds, come on. 7, come on.
Sir, option C.
All right, so you want class 2B, option C. Okay, lock option C. Oh, that's a hat trick of misses. All right, 3 on a trot. Well, well, well. So conditions surely are overcast. You need to buckle up, Dolphins. Better luck in the next few questions. And question number 4 on your screen now.
Which of the following variables is associated with a poor prognosis? A. Device-related infective endocarditis. B. Heart failure. C. Streptococcus viridans. D. Right-sided valvular regurgitation. E. Osler nodes.
Start now.
इसके अंदर वेरिएबल्स हमारे पास इनमें से जो सारे के सारे को फोकस करते हैं इसका पूरा प्रोसेस से तो इसका हार्ट फेलियर
20 seconds.
हार्ट फेलियर
10 seconds. Come on. 7.
Sir, option B.
Heart failure, option B. You want me to lock it? All right. Option B. Lock it, please. Oh, yes. Finally. We are on the board now, Dolphins. Well played, but you've got to keep it consistent. And hopefully, I think we'll have a good score. Come on. Next
You
question.
just opened the account.
Very right, sir. The account has been opened. This may turn out to be the start that they wanted. So you can still make a good comeback. Now, question number 5. On your screen, M.I.C to read.
A high Charlton comorbidity index is associated with poor prognosis in infective endocarditis. Which of the following variables of said score is associated with the worst prognosis? A. Age, B. Liver disease, C. CVA, D. AIDS, and E. Leukemia.
60 seconds on your screen.
इसमें क्या comorbidities के मतलब like AIDS के पास सारे comorbidities के मतलब तो scoring index जो सब करते हैं comorbidity क्या what image also
Approaching 20 seconds. 15 seconds. 10 seconds. 7, 6.
Sir, option D.
D for Delta.
Yes, sir.
AIDS. Okay, so they want us to lock option D. Yes. Another 6. Great stroke. Over the covers. Well done. Just at the last moment you got it right. Well played. Now, question number 6. On your screen.
A third blood culture is sent which comes out to be positive. Which of the following microorganisms is most likely to be reported on the blood culture report? A. Staph aureus, B. Streptococcus bovis, C. Streptococcus viridans, D. Hesse group, and E. fungi.
Your 60 seconds start now.
Usually culture negative होते हैं उसके लिए reset होते हैं
नहीं मसरूफियत 20 seconds. 15. 10 seconds. Come on. Dolphins. 7 seconds.
Option B.
Strep bovis. Option B. Right? Okay. Lock
Yes, sir.
option B. Yes. So well done. So it's a hat trick of correct answers. C
उनसे तो पहले क्या हुआ था?
3 6s on a trot. I think they had to hear your voice, sir. That's all I can say. That has turned their luck around. So, very well played. Very well played. And, well, we are moving towards a good total now. Come on, keep it up. Next question is on your screen now.
Which of the following congenital heart anomalies is not associated with infective endocarditis? A. Bicuspid aortic valve, B. AST primum, C. AST secundum, D. Both A and B, and E. Both A and C.
Start the timer.
easy to close closest to the response होता है
सेकंड होता है हमारे पास नहीं सर सेकंड को ओवेल होता है पूरा में मिलेंगे सेकंड में प्राइमर बस नीचे वाला और करीब
difficult to close इसमें seriously कोई associate होता है क्या
20 seconds. 15. 10.
तो है answer.
7. Come on. 6,
C.
4, 3.
So option E.
Well, I think I'll have to take this one to the umpires. Sir, what's your opinion? Were they in time?
I think I'll give them.
All right. So, the umpires.
If the Professor Kazmi has no objection.
Well,
I think
yes.
they were okay. Just I think short within time. Yeah.
Okay. So I think that's what the panel has decided. They want to give it to you. All right. So which option should we lock?
E दिया था. So option E.
Okay. Yes. So it was option E. Lock option E, please. Oh. So that one came in and stumped you.
काम नहीं आया इनके.
Oh yes, because E was always going to be wrong, and it got them. So anyhow, you still have 3 more questions, and I think you need to score. All right. Moving to question number 8. M.I.C. to read the question, please.
Which of the following is a vasculitic phenomenon of Duke's criteria? A. Janeway lesions. B. Roth spots. C. Osler nodes. D. Glomerulonephritis. E. Rheumatoid factor.
And timer starts now. So I'd like to welcome Professor Dr. Tariq Farman Saab to the show. Welcome, sir. Twenty seconds. 15.
B.
Hurry up.
So option
10.
B.
Option B. Roth spots. Option B. Roth spots, right? That's what you want? Okay. So lock option B. Oh goodness. Another one passing and being missed. All right. So, well, 2 more questions. You really need these questions. Moving to question number 9. On your screen, please.
With regards to the patient's pacemaker, what should be done as part of management plan of infective endocarditis? A. Removal of pacemaker and reimplantation at the same site immediately. B. Removal of pacemaker and reimplantation at a different site immediately. C. Removal of pacemaker and reimplantation at a different site after 1 negative blood culture. D. Removal of pacemaker and reimplantation at a different site as late as possible. E. Antibiotic therapy and no need to remove the pacemaker.
And your 60 seconds start now.
Different after 1 negative blood culture you should notice the requirement implantation से पहले negative आपको सारे के रिमूव करने के बाद में नेगेटिव ब्लड कल्चर भी नहीं होना चाहिए इमीडिएटली तो नहीं करते करेंगे बस लेवल का बेस पे इम्प्लांटेशन पे साइड आफ्टर 1 नेगेटिव ब्लड कल्चर न्यूज़ लेटेस्ट बी
20 seconds. Come on, Dolphins. It's quite crucial. 10 seconds. 7. Come on. 5.
So option B.
B for beta.
Yes, a beta.
Okay. Lock option B. Oh, missed yet again. Oh, that was a crucial one for you. Okay, so with this, we are now going to move to the last question of this innings. Question number 10 on your screen.
What should be the duration of antibiotic therapy in this patient post removal of CIED, given that the patient's thoracic CT revealed septic pulmonary emboli? A, 1 week, B, 2 weeks, C, 3 weeks, D, 6 weeks, and E, 9 weeks.
And timers on your screen.
इसके अंदर हम प्रोग्रामिंग वो करके करेंगे कि सेपरेट पार्टनर बनाए तो यहाँ पे 9 वीक का ही करके हो जाएगा ओनली डॉट के पहले ताकि राइट नाउ ऐसा है कि 9 वीक का करके Sir, option E.
Okay, so are you sure about option E? That's 9 weeks.
Yes, sir.
Okay. Are you sure you want me to lock it?
Yes, sir.
Okay, they seem to be confident. In pursuit of 24, lock option E. Oh, goodness. Another one missed, so that leaves us with a total of 18. Well, I think it's definitely going to be a low scoring innings, but let's see. The match is not over. It's not over until it's over. So you still have to give a good fight, and I think we've now come to the first half of the game, and I'm going to request our experts to give their opinion. And first of all, I'd like to move to Professor Mohammad Ishaq Saab. Sir, your thoughts.
Thank you very much. I think you have got a very big panel today. They made some comments, but I was a bit disappointed by the performance of the team. I wish they had scored a bit higher, because I think this is one of the lowest scores that we have seen in the previous matches. So otherwise, the question was quite rational, and probably they were not well prepared. So I feel a bit disappointed and sorry for them.
Right, sir.
But let's see how the other team does.
Right, sir. Very right. And I'll now move towards Professor Khabar Kazmi Saab. Sir, can we have your thoughts on the game so far?
Yeah, I think same points as Ishaq Saab has said. They were not informed today. I mean, but I think they still have a chance. Let's say, how do they bowl today? They may even bowl better than the other team. So I think best wishes to both the teams. The best will be winning here.
Very right, sir. It's definitely not over. The second innings is still to go, and we have Professor Mohammad Hafizullah Saab. Are you there, sir?
Yeah, thank you. It's a very important subject, and I think the questions were drafted properly. Though a little confusing, I don't want this A and C and A and B. I hope next time when we prepare questions, we do not have this sort of a confusion, A and C and A and B. I think we should have more questions. The questions were quite good, and I think this is an important subject, and I'm very happy that we have been able to create awareness about this important subject. And that is the beauty of this competition. Thank you.
Thank you very much, sir. I think points well taken, very rightly said, and I think the council to look into it. But I think with this, I now move towards Professor Fawad Farooq Saab. Definitely.
I think they don't have to lose their heart, because most of the time we think ischemia, arrhythmia, heart failure, hypertension as cardiology, and beauty of this cardiac super league question make is that it's touching every aspect of cardiology. So they are unfortunate that they are dealt with a device-induced infective endocarditis and its details, but that's the game. You have to go through everything in a bit of detail so that you can be able to at least pick the options. But I think still they have chance, and let's see how the second inning goes. But one or two very important points I would suggest. One is the muting of mic from the expert part. So whenever we join, we should mute our mics. And second, I think I'm seeing Dr. Tariq Farman, at least team's mentor, or if mentor isn't possible to join, then at least coach should be joining so that they should really further than give their advice regarding further preparation. So that is for future advice. And I'll make my effort as well to at least message a coach or mentor should join. But here I'm seeing Dr. Tariq Farman. Okay to Hamza.
Very right, sir. I think very good points made here. We definitely want the coaches and the mentors to be involved. I think that's going to give more support to the teams, and also this will take us towards improvement for further matches, as we all know. And we do have Professor Feroz Mehman Saab. Can we have his comments, please?
Thank you very much. I've seen Khabar after a very long time. Welcome, Khabar. Welcome back to Pakistan. And I hope you will keep on joining us. Thank you, Wilson. I appreciate your support in this program and all the panelists, coaches, and mentors. I would now actually recommend one thing to a newer generation and youngsters, that generally the concept is that ischemic heart disease, coronaries, interventionist cardiology. And from these contests, now we realize that it's just 20% of cardiology, the intervention. We should come out of it, and we should cover other very important subjects which we are lacking in knowledge and we do not discuss in our meetings and conferences. So thank you very much. I think this has really given us emphasis on what the real cardiology is and this what needs to be done. And I'm sure the losing team should not lose the heart, because they've got still a lot of ground left and they can still win, like Afghanistan did. So I'm sure you'll come back in the game. Thank you very much.
Thank you very much, sir, for your comments, and I'm really excited to have the representation from the structural side. I think we have Dr. Ali Raza, our expert in structural interventions. So, sir, your comments, please. Are you there? I see another esteemed member of Pakistan Cardiac Society, and we do have Professor Dr. Imran Saeed. Sir, it's great to have you on the show. Your thoughts, sir?
Thank you very much. Yeah, unfortunately, I joined it very late. I was busy. In fact, I'm traveling, so couldn't hear all of it. But these meetings are very useful, and it's a good learning experience, especially for the young doctors and also to the senior faculty also, because we learn lots of things from our juniors also. So by and large, it's a good experience, and I think such meetings should continue, and all the best.
Thank you very much, sir. I think we do have Dr. Ali Raza, our structural intervention expert. Sir, can we have you?
Hamza, I think we should move on to the next.
Okay, sir. Okay. I think with this, since due to paucity of time and we have to start the next inning, I think we move towards the second half. So here we have the total to beat is 18. And the team facing the music is now M.I.C. Panthers. So can we have the scenario on the screen? Dolphins, to please read the question. The Vinay. Read the scenario, please.
At 36 weeks of gestation with a history of worsening dyspnea, fatigue and palpitations over the past month. She mentions a previous diagnosis of rheumatic fever during adolescence, which has led to severe mitral stenosis. On examination, she appears anxious and is visibly short of breath. Her vital signs reveal a heart rate of 110 beats per minute, blood pressure of 150 by 90 mm of mercury, respiratory rate of 26 breaths per minute, and oxygen saturation of 85% on room air. Cardiac auscultation reveals a loud S1, an opening snap, and a low-pitched diastolic rumbling murmur best heard at the apex, consistent with severe mitral stenosis. Additionally, there are signs of right-sided heart failure, including jugular venous distension and lower extremity edema. She is in active labor, experiencing regular uterine contractions. However, during the course of labor, she suddenly develops right-sided weakness and slurred speech, indicating a possible ischemic stroke. A neurology review was immediately sought, and NIHSS score was calculated, which was 4.
All right, M.I.C. Panthers, you have a couple of seconds to gather. Let me know when you're ready.
के दौरान उसको सीबीए हो गया, पेशेंट का ब्लड प्रेशर ज़्यादा है लेकिन उसकी सैचुरेशन भी ड्रॉप कर रही है।
अच्छा, मैं जैसे स्कोर अगर 5 से कम होता
इसको हुआ इस्केमिक स्ट्रोक।
हाँ, और एनआईएच स्कोर अगर 5 से कम होता तो बेटर होगा।
All right, so can we have question number 1
Immediately sort है.
on your screen? Read the question, please. Dolphins.
In a pregnant patient with severe mitral stenosis, which hemodynamic parameter is most likely to be elevated due to increased right heart pressures? A. Mean pulmonary artery pressures. B. Pulmonary capillary wedge pressure. C. Left ventricular end diastolic pressure. D. Systemic vascular resistance. E. Central venous pressure.
And you have 60 seconds to answer. Timer starts now.
बढ़ जाएगा. ना पल्मोनरी आर्टरी प्रेशर,
कैपिलरी वेज प्रेशर भी इंक्रीज होगा ना,
वो भी प्रेशर लेकिन राइट से बढ़ना है, राइट से क्या बढ़ेगा? एडी भी बढ़ेगा, सिस्टमिक बढ़ेगा, मुझे लगता है सीवीपी है,
पोस्ट कैपिलरी है ना ये, पल्मोनरी हाइपरटेंशन पोस्ट कैपिलरी है ना, तो इसके अंदर आप पल्मोनरी कैपिलरी वेज प्रेशर भी बढ़ जाएंगे ज्यादा,
तो एलवी प्रेशर तो बढ़ा होगा,
सिस्टमिक वैस्कुलर रेजिस्टेंस तो कम होगी,
वो तो कम हो जाती है डिलीवरी के टाइम। बी बी ऑप्शन बी क्या देना?
दानो we would like to go with option B.
B for bat, beta.
Yes.
Yes.
Pulmonary capillary wedge pressure. All right, so they want to go with option B. Lock option B, please. Oh, you came down the wicket a bit too early. Well, it's been missed. As we've been saying, I think overcast conditions, pitch seems to be a bit difficult, but we thought it would be an even Steven kind of a wicket. Anyhow, moving to question number 2 on your screen.
What is the optimal timing for percutaneous mitral balloon valvuloplasty in a pregnant patient with severe mitral stenosis? A. First trimester. B. Second trimester. C. Third trimester. D. Postpartum period. E. When symptomatic despite optimal medical management.
Start the timer.
20 वीक के बाद आप कर सकते हैं, 20 वीक्स के बाद कर सकते हैं, सेकंड ट्राइमेस्टर ठीक है, बट ऑप्टिमल टाइम सेकंड ट्राइमेस्टर क्या दें? When symptomatic despite optimal medical management.
Timing for percutaneous
In a pregnant woman with severe MS है, severe symptomatic है तो second trimester है, 20 हफ्ते बाद होती है, second trimester बोल दें, बस यही बन सकता है,
postpartum period,
second trimester.
Option B.
Okay, so you want me to lock option B. So you really seem to be in a hurry, coming down the wicket, trying to hit it for a 6. All right. I'm going to lock option B. Lock it, please. Well. As they say, haste makes waste. And I think Ishaq Saab is going to intervene now, for sure.
20 weeks नहीं, after 20 weeks नहीं होता.
So with this,
I think this time it was past the limit.
Yes, sir. So I
My
think
opinion.
very right. So with this, we move to question number 3. Well, there next. Question number 3. Read the question 3, please.
Which echocardiographic parameter is most indicative of severe pulmonary hypertension in a pregnant patient with mitral stenosis? A. Tricuspid annular plane systolic excursion TAPSE. B. Right ventricular outflow tract velocity time integral RVOT VTI. C. Pulmonary artery acceleration time. D. Pulmonary artery systolic pressures. E. None of the above.
And the timer starts now. So M.I.C is yet to get off the mark. Just like DOW Dolphins.
पल्मोनरी आर्टरी सिस्टमिक प्रेशर कम हो सकता है, जब आरवी फेलियर हो जाएगा तब नहीं बढ़ेगा, वो पल्मोनरी आर्टरी एक्सेलरेशन टाइम है, ये हमेशा आरवीओटी एक्सेलरेशन टाइम होता है या पल्मोनरी आरवीओटी वेलोसिटी टाइम इंटीग्रल है, आप पल्मोनरी आर्टरी एक्सेलरेशन टाइम क्या है?
एक मिनट ना, उसको भी थोड़ा रुक जाए,
कब तक होता है?
लास्ट के अंदर 10 सेकंड में जवाब देंगे।
पल्मोनरी आर्टरी एक्सेलरेशन टाइम होता है लेस देन 80 मिलीसेकंड,
होता है पल्मोनरी आर्टरी सिस्टोलिक प्रेशर,
पल्मोनरी आर्टरी एक्सेलरेशन टाइम है सी।
Approaching 20 seconds.
It's option C है, बताओ तुम लोगों को लगता है तो बताओ, पल्मोनरी आर्टरी सिस्टोलिक
15 seconds.
Option C.
Okay. So they are really crying out loud. Option C, pulmonary artery acceleration time, right? So lock option C. Oh goodness! So they are just following the footsteps of DOW Dolphins, missing 3 on a trot. Well, sir, I think it seems as if they are batting in England under overcast conditions. So, well, moving to question number 4.
Can we discuss at the end of the session, or we can discuss now if we have a doubt about the key?
Okay, so we'll have a discussion at the end where the umpires can take your issues, and then we can answer and we can have a discussion. So we do have a panel of experts, so don't worry. I think in the end we may have a discussion on that. Right, so moving to question number 4.
What is the recommended mode of delivery for a pregnant patient with symptomatic severe mitral stenosis? A. Vaginal delivery. B. Cesarean section. C. Forceps assisted delivery. D. Vacuum extraction. E. All of the above.
All right, 60 seconds, start now.
Vaginal pregnant patient with symptomatic severe MS. Subsymptomatic patient को किस तरह
Symptomatic
If they have any queries, they can raise that can be looked at by umpires during the match, and then umpire can come up with conclusion later on after the inning.
Very right, sir. Okay, so teams to continue, I think.
Obviously,
Yeah.
Symptomatic.
30 seconds, come on.
Symptomatic B. बोल देते हैं, time बचाओ.
Option B.
Option B, C section.
Option B, cesarean section. All right, lock option B. Well done. You're on the board now. Just like Dolphins, they got their 4th question right, and you are doing the same. So I think we may have a match on our hands.
टीमें लगता है बराबर की हैं बिल्कुल.
Very right, sir. Well, let's see. You never know where it goes in the end, but best of luck to both the teams. And we move to question number 5.
Second trimester for that was a discussion.
Read the
Among
question.
the pregnant patients with severe mitral stenosis, what is the most common fetal complication? A. IUGR intrauterine growth restriction. B. Premature rupture of membranes. C. Congenital heart block. D. Fetal death. And E. Preterm birth.
60 seconds, start now.
E में देखना है. IUGR या premature birth.
सुन रहे हैं इसके अंदर मोस्ट कॉमन फीटल कॉम्प्लिकेशन
IUGR या preterm birth होती है.
और severe MS में
नहीं कह रहा हूँ.
severe MS में ज्यादा पेशेंट प्रीटर्म में जाते हैं.
प्रीटर्म या IUGR तो वो कौन सा बंदा है? प्रीटर्म या IUGR? प्रीमेच्योर रप्चर ऑफ मेम्ब्रेन नहीं होता.
अभी हमारा टाइम है, टेंशन ना लें आप.
बताना तो है.
ना इतने तो
फीटल डेथ नहीं होती. IUGR या प्रीमेच्योर बर्थ, ये बताओ. IUGR या प्रीमेच्योर बर्थ.
प्रीटर्म बर्थ के ऊपर जाएंगे मेरे ख्याल में.
I think
20 seconds.
Restriction में जाना चाहिए.
नहीं.
Intrauterine growth restriction.
15 seconds.
Option A.
चले.
बताओ.
ठीक है.
10 seconds.
ठीक है.
9.
Option A. Option A, intrauterine growth restriction.
Option A. All right. They want to lock option A. Lock it, please. Yes. Well played. Well done. I think the discussion was pretty spot on. It did make a difference. So I think you guys are discussing and discussing well. This one you got right. But you've got to pay more attention towards the questions and the answers that you have. And this may just be the difference between the two teams. Let's see. We still have a few more questions. And you have to get one more question to tie the score.
Right.
Question number 6. On your screen.
Which surgical intervention is associated with the highest maternal mortality rate in pregnant patients with severe mitral stenosis? Percutaneous mitral balloon valvuloplasty, mitral valve replacement. C is coronary artery bypass grafting. D, aortic valve repair. E, open mitral commisturotomy.
And timer starts on your screen now.
PMC की नहीं होती, कोरोनरी आर्टरी बाइपास ग्राफ्टिंग की भी इतनी नहीं है, एओर्टिक वेल्व रिपेयर की कम है, ओपन माइट्रल कमिस्टोटमी की कम है, MVR की सबसे ज्यादा मोर्टेलिटी है. 5%
होने लगा उसमें पेशेंट में.
नहीं, पेशेंट को छोड़, उन्होंने मोर्टेलिटी बताई है प्रेग्नेंट में. MVR है ये. इट्स MVR. तुम लोग बताओ MVR और क्या क्या?
Aortic valve या mitral valve.
mitral aortic की mortality कम होती है प्रेगनेंसी वो उसमें ओवरऑल मैं प्रेगनेंसी मुझे नहीं पता mitral valve है mitral valve की ओवरऑल प्रेगनेंसी mortality कम होती है mitral valve की बी कर देते हैं
एक मिनट में इसको कर लें
mitral valve replacement इसकी mortality कम
ऑप्शन बी
B for beta.
ज्यादा होगी इसकी maximum mortality होगी
You want me to lock MVR? Option B, right?
Yes.
Okay.
Yes.
So they are quite convinced. Lock option B. Yes, and I think that's what it was. Very well played, quite convincing. And I think we all enjoyed the way they answered. Well done, team. So with this, the scores are level now. Well, you still have a lot of questions to answer. And let's see what happens. Question number 7 on your screen now.
What is the recommended initial management strategy for an acute ischemic stroke during the labor? Immediate administration of intravenous tissue plasminogen activator, TPA. B, urgent transfer to a comprehensive stroke center for endovascular thrombectomy. C, stabilization of maternal vital signs and neurological monitoring. Defer the TPA administration until postpartum. D, immediate induction of labor to expedite the delivery and reduce the maternal stroke risk. E, administration of aspirin and other antiplatelet agents.
And your timer starts now.
Initial management क्या है? Initial management
delivery नहीं हुई
लास्ट सुना ना
What is the recommended initial management?
Initial management क्या है? Initial में
patient labor में है patient labor में
एस्पिरिन तो दोगे ना उसको या नहीं दोगे?
नहीं देंगे हम उसे स्टेबल डिलीवर तो करवाएं लेबर में जो है
इनिशियल मैनेजमेंट क्या है?
एडमिनिस्ट्रेशन
ऑफ एस्पिरिन देंगे आप उसको
एंड अदर एंटीप्लेटमेंट
इसका ना NIHS स्कोर भी लेस देन 4 था
हां लेबर में एस्पिरिन देते फिर बताओ सी या ई सी देते हैं सी ऑप्शन देते हैं यार हम लेबर में एस्पिरिन देते फिरेंगे
सी अप्रोचिंग 20 seconds
हां बताएं आप बताओ जल्दी
ठीक है सी
ऑप्शन सी चार्ली स्टेबलाइजेशन ऑफ मेटल वाइट
so they want us to lock option C. Let's see whether this is where they win. Option C, lock it please. Oh yes, very well played. Loved the camaraderie. I think the discussions have been pretty good, very convincing and very well played. Well done. So we now do have the winners, but I think we'll go through the whole series of questions. Can we have the next question on the screen? Read the question.
Among the pregnant patients with acute ischemic stroke, what is the most common cause of maternal mortality? A, hemorrhagic transformation of ischemic stroke. B, neurological deficits leading to cardiopulmonary compromise. C, fetal distress necessitating emergency cesarean section. D, pulmonary embolism secondary to prolonged immobility. E, eclampsia or severe preeclampsia.
Timer starts now. I would request everyone to keep their mics on mute, except for the team answering.
Most common cause.
Hemorrhagic transformation हो गया पेशेंट को न्यूरोलॉजिकल डेफिसिट लीड टू कार्डियोवास्कुलर कॉम्प्रोमाइज ऐसा नहीं है फीटल डिस्ट्रेस नेसेसिटेटिंग इमरजेंसी सेक्शन फीटल डिस्ट्रेस जो है वो मैटरनल मोर्टेलिटी को नहीं करता पल्मोनरी एम्बोलिज्म कैन लीड टू प्रोलॉन्ग्ड एक्लेम्पशिया और सीवियर एक्लेम्पशिया एक ये हो सकता है कि हेमरेजिक ट्रांसफॉर्मेशन ए और डी लेना हेमरेजिक ट्रांसफॉर्मेशन भी हो सकती है और पल्मोनरी एम्बोलिज्म कैन लीड टू प्रोलॉन्ग नहीं ए करो
Approaching 20 seconds.
Most common cause ने क्या है? जल्दी का
15 seconds.
बताओ ए या डी
10 seconds. 7
डी कर देते हैं डी
option D. So they want us to lock option D. Lock option D, please. Oh, so that turned out to be a tricky one. An off-cutter came in and hit the stumps. Never mind. Now M.I.C is actually playing for score, and the more you score, it may just help you in the subsequent games overall. Well, moving to the second last question now. Question number 9.
Which neuroimaging modality is preferred for evaluating her ischemic stroke during pregnancy, considering both maternal and fetal safety? A. CT angiography, B. MRI with gadolinium contrast, C. Transcranial Doppler ultrasound, D. MRI without gadolinium contrast, E. Non-contrast CT.
All right, timer starts now.
Think about C and D. Transcranial Doppler ultrasound कुछ नहीं करेगा. Without gadolinium होता है.
किसी type of वो नहीं देना contrast.
Without gadolinium contraindicated है pregnancy में. ये बता दो ट्रांसक्रेनियल डॉपलर अल्ट्रासाउंड या फिर मैग्नेटिक रेजोनेंस इमेजिंग विदाउट gadolinium contrast. सिटी हमने करना नहीं है.
डी करेंगे इसके लिए.
डी ऑप्शन डी को चेक करना चाहिए. कंट्रास्ट हमें मैग्नेटिक रेजोनेंस इमेजिंग विदाउट gadolinium contrast. तुम लोग एग्री करते हो?
डी यस.
डी ट्रांसक्रेनियल डॉक्टर अल्ट्रासाउंड इसका हमें पता ही नहीं है. हमने कभी पढ़ा ही नहीं है. हमने कभी पढ़ा ही नहीं है. डेल्टा ही कह देना चाहिए.
देन डेल्टा शुड बी एन आंसर, है ना?
Approaching 20 seconds.
बोल दो. 1 मिनट में. तुम लोग बताओ ना.
15 seconds.
है नहीं खत्म हो रहा है टाइम. ट्रांसक्रेनियल अल्ट्रासाउंड हमने कभी नहीं सुना यार.
10 seconds.
ऑप्शन डेल्टा.
Okay. So they want us to lock delta. All we could hear was either delta or gadolinium. Okay, lock option D, delta. Very well played. Well done. So you deciphered it well. Well played. I think the way you were thinking was pretty smart. Well done, M.I.C. Keep it up. Moving to question number 10 now. Last question of the innings.
Which type of anesthesia is considered the safest option for her during labor and delivery, giving her complex medical history? A. General anesthesia, B. Regional anesthesia, C. Local anesthesia, monitored anesthesia care, D. MAC, or E. Combined spinal epidural anesthesia.
And the timer starts now.
जनरल एनेस्थीसिया की जरूरत नहीं है. रीजनल एनेस्थीसिया या फिर कंबाइंड इसको एनेस्थीसिया स्पाइनल एनेस्थीसिया होता है. स्पाइनल एपिड्यूरल इज द सेफेस्ट. अब ये कंबाइंड का वर्ड क्या है?
कंबाइंड स्पाइनल एपिड्यूरल.
तो आप लोगों को पता है कंबाइंड
लोकल तो नहीं होगा.
एनेस्थीसिया में हो. मैं उसको स्पाइनल दोगे आप?
स्पाइनल कौन सा है? बट एनेस्थीसिया कंसीडर सेपरेशन फॉर द लेबर एंड डिलीवरी गिवन हर कॉम्प्लेक्स में. मैं तो इसको एपिड्यूरल ही कहूंगा. जनरल नहीं कहेंगे आप. जनरल इज नॉट अलाउड. जनरल पल्मोनरी हाइपरटेंशन के पेशेंट के अंदर बड़ा रिस्क करता है. आप लोग कंफर्म करते हो? मुझे तो एपिड्यूरल पे ही है.
मैं देखता हूं आ रहा हूं. ये गेम पे खत्म हो जाएगी.
डी कर लो.
मैं तो इसे नहीं ई कहता हूं. मॉनिटर एनेस्थीसिया.
Approaching 20 seconds.
ऑप्शन अच्छा ठीक है. ऑप्शन ई कंबाइन वो एपिड्यूरल एनेस्थीसिया.
Okay, so they want to go for option E. Lock option E, please. Oh, you missed it. Never mind, but I think you did play well in the end. And with this, you have won the game today. So congratulations to M.I.C. Multan for winning this league game, and commiserations to the losing team today, which is DOLPHINS. And with this, I'm going to move towards our panel of experts, and I would like to take the comments from Professor Dr. Abdul Hamid Siddiqui. Are you there, sir?
इंटरप्ट करना चाहिए.
Okay, so I think we have Professor Mohammad Ishaq Saab, sir. Your thoughts on the game and the match today?
Well, the thoughts are very obvious. One team was less prepared than the other one, so naturally one has to lose. And I think Professor Tariq Farman has to work hard to train his team. Both the questions, as pointed out by Professor Fuzullah, were very pertinent, relevant questions, and they were covering the day-to-day cardiology. So I think a bit of a disappointment for Dolphins, but never mind. They should not give up, prepare more accurately and more effort.
Right,
and
sir.
I think, as somebody has already pointed out, we are also learning from these questions and answers, and I think the whole exercise is very productive and fruitful. So I think you have got a very large panel. I won't take much time. I'm here in Swat, and I will just take your leave. And
right, sir. There's one more thing, sir. I think
I congratulate the evening congratulate the winning team, and
Sir
I
Ishaq?
would like to encourage the team which has defeated. They should improve their performance.
Right. So,
Regarding a disputed question, they can send the question because we have got the reviewers have got backup references to support their answers.
very right, sir. So, I think this has been explained by Professor Dr. Ishaq, and since he's one of the umpires today, and thank you very much, sir, for your input. And I'd now like to move towards Professor Khabar Kazmi Saab. He's the second umpire for today's match. Can we have his words?
Okay. First of all, congratulations to the winning team. I think there is always in a game there is a winner and there is a loser. So, but you keep on making an effort, and there is a time when you would win also. So, they should continue making an effort. The other team, Dolphins. Thank you for excellent moderation. I think you did an excellent job. I mean, keeping everyone involved. And thank you to the other panelists also. As far as that question is concerned, I have checked that, and I think that correct answer was the correct answer. So anyway, it doesn't matter now for the Panthers because they've already won the match. If it would have been a tie, then we probably would have reviewed it further and then seen whether their argument is correct or not. Thank you to Wilson as well. I think it's going very well. And on to the other panelists also. Thank you.
Thank you, sir, for your comments. And we do have Professor Hafizullah. Sir, are you there? Your comments? Okay, so we do have Professor Fawad Farooq. Sir, your input?
Yes, I would like, it's good to see more and more faculty involving in and seeing how Professor Power Kazmi after a long time. But I'm seeing still Professor Dr. Ali Raza and Dr. Tariq Farman as well.
Yes,
so
yes.
I think you take their comments and then finally conclude.
I'm extremely excited to have all of them, new members of the faculty, and I think we have the structural team here. So, Dr. Ali Raza, are you there, sir?
Yes, thank you so much. Sorry, I had to nip in and out because I was on call as well. But an excellent performance, and winning and losing doesn't matter, to be honest. Winners, congratulations to them, but it shouldn't stop you from learning. Even I think I learned a few things from the questions as well. An excellent job by you as well. You kept it so very well engaged. So well done. And thanks to Wilson and everyone for continuing this activity because it's a continuous learning process for everyone. So thank you so much.
Thank you very much, sir. I think it's great to see the faculty and all of you, and I think it's encouraging for the teams also. And we do have Dr. Tariq Farman. We'd like to take him on board for his comments. Sir.
Yes, can you hear me, please?
Sure,
can you
sir.
hear me?
Yes, we can hear you, sir.
Yeah.
Please.
So first of all, I would like to congratulate you, all of you and organizers that they have transformed a great learning experience into a very interesting game show. So it's a continuous learning experience for all of us. And keeping aside the performance of the teams, that's the part of any game. So I would like to congratulate the winner. And I would say that this exercise is a the learning experience, and it gives a opportunity to all of us to assess ourselves and to improve ourselves, and that is the great thing of this game. Thank you so much for inviting me.
Very right, sir. It was great to have you, and I think the idea is to learn from these events and these shows. I think we all try to compete in our everyday life, and to be honest, nobody loses in the end. It's always victory for everyone. And we do have Dr. Imran Saeed. Can we have his final comments on the game, sir?
Well, it was a very well organized and very well managed activity. I'm really impressed with the questions which were put forward. Both the teams, they tried their best. They were very logical. However, one team was definitely better than the other. And well, it's a continuous activity, and we all learn from it. And it was a good experience. Thanks to Wilson.
Thank you very much, sir, for your comments. Great to have you. And we also have the coach of M.I.C, Panthers, the winning team, Dr. Shoaib. So can we have his input? I've just been told he's there.
अस्सलाम वालेकुम। सबसे पहले तो सर आप हमारे सीनियर्स हाईली उनका शुक्रिया अदा करते हैं कि उन्होंने ये ऐसा फोरम बनाया है कि मैच तो अलावा है, लेकिन इससे हमारा जो एक स्टडी का एनवायरनमेंट डेवलप हुआ है ओवरऑल पाकिस्तान में कार्डियोलॉजी के फोरम पे, तो ये बहुत अच्छा है। दोनों की लर्निंग हुई है, हार जीत तो होती है एक टीम की। तो बेस्ट विशेस फॉर डो, और हम कांग्रेट करते हैं अपनी टीम को, और ये आप लोगों का सारा सुपरविजन और अच्छी एक arrangement as.
Very well done. I think your team did great, and we just want the fight. It's always the fight that matters, and I think it's wonderful to have such activities. And with this, I now move to Professor Fawad Farooq. I think we're coming towards the end of the show, and sir, your final thoughts, and then we'll.
Yes, Hamza, overall a very nice very nice match, nicely moderated by you as well. And I think all has been said, so there's nothing more to be added to that. So over to you for conclusion.
Very right, sir. Thank you very much. I think you all put so much of effort into this, and I think it's your presence, the presence of the panel, which makes all the difference for our juniors, for our trainees, and I think for the show in general. And it's always a treat for me to be here, and it's a wonderful experience for everyone. And I think today we had an interesting game, not a very high scoring game, and I think since the weather is pretty overcast, at least here in Islamabad, Pindi, this is how it was in the match, and it was.
Sorry to interrupt. I want to discuss a scenario with my experts.
All right.
Can we?
Okay, I'll ask the panel if. Do we have anyone from the panel, Dr. Fawad? Is he there?
Question number 3.
No, just we want to clarify what sort of scenario. Do you have any criticism to that or any objection?
No, I just want to clear the thing out. That was in question number 3. The best indicator of the pulmonary.
Yes, Dr. Khawar Kazmi has checked it, and it's a right question and right answer. But still, you have doubt, you can write it to our board, and they will see it again.
Thank you so much.
Okay. Yes, Hamza, just conclude.
Right. So I think whenever you have any queries, it is, we've got a panel, and we've got a panel of reviewers also, so you can write it down, and that question can be reviewed. And with this, I think we now conclude the match today, and we can only have one winner, and we have M.I.C Panthers winning today. But I think DOW Dolphins, they are taking home a lot with them, and hopefully next time they'll be much stronger. And it's not the winning, it's actually the participation which matters, and we are all learning from this experience. And with this, we'll call it a day. Until next time, Allah Hafiz from me and all of us here from the